Good morning. Welcome to Doc Talk Live. My voice, this is Dr. Brad Goodman. On camera, I have Dr. Kenny Bramlett. We're at the Surgical Institute of Alabama. In a minute, we are going to show a live surgery on the foot to release the plantar fascia for plantar fasciitis. Dr. Bramlett, thank you for talking with us today. Typically we think of plantar fasciitis as a non-surgical type of problem. In fact, the idea of surgery for this problem rarely enters into my mind. So I'd like you to start there about surgery for this very recalcitrant problem. That's a really tough problem that a lot of people face.
Yeah. Well, in orthopedic practice, we'll see 3 to 5 people at least a week who have got plantar fascial pain, which is on the bottom of the heel, as opposed to Achilles tendonitis pain, which is on the actual back of the heel. And I've drawn just a quick sketch here. Where the Achilles tendon comes down to the back of that calcaneus, that's the calcaneus there. The Achilles tendon comes down and attaches. Sometimes you'll get Achilles tendonitis, and even sometimes it'll grow a bump behind it, which is called a pump bump, or we call it Haglund's deformity. Where on the Achilles tendon in development goes on along the undersurface of the calcaneus and becomes what is the plantar fascia, which is kind of like a bowstring to the arch of the foot. If you look at the foot, it has an arch to it. People have an arch in their foot. So the plantar fascia holds that arch in the foot when people walk. So it's a spring to keep it rigid. As you get older, you lose the segments of ligaments between the joints of your foot and your foot. You hear people talk about collapsing arches or falling arches.
Right.
Not uncommon. More in women than men because of the type of shoes they wear and the activities that they're involved in. So when that plantar fascia gets stretched, because if you load the foot from the top, which is just a standard load, and that plantar fascia gets stretched repetitively, what happens is it'll make little micro tears on the heel, on the bottom surface. So you'll get heel pain right on the bottom. It feels like a nail, extremely tender.
Right. People get up in the morning and they hobble to the bathroom.
Hobble to the bathroom. Once they warm it up and that tendon or that plantar fascia gets stretched, then it's out to length, then the pain goes away in 5 to 10 minutes. They sit down at lunch, it comes back again, severely painful. I mean, people say, cut my leg off. They're so hurt so bad sometimes. Of course, we don't do that. But anyway, so here's a normal sketch. This is plantar fascia on the bottom of the calcaneus pulling. It'll pull in this direction, this way, towards the toes as it's loaded. And as it pulls repetitively, more and more and more, what happens is the plantar fascia, which is again this long plantar fascial plate, which is a thick, it's a flat ligament, if you will. It's wide, like 2 inches wide at the forefoot and about 1 inch wide at the back. It'll pull, and those little micro tears gradually will develop what is, I'm sketching that there in dark blue, it'll grow a spur, kind of like a stalactite from a cave. It'll grow a stalactite. We jokingly call it a stalag right and a stalag left. Okay? Okay. So there you have this plantar fascial spur. So the issue is, how can you make that painful calcaneus smooth on the bottom, as opposed to having a spur sticking off, much like that.
Right, but the spur is not necessarily the painful part, it's the reaction to the problem.
Right, because the plantar fascia comes out, and then around that is inflammatory tissue that's surrounded above and below. And even the spur, and some people get in there, and that's cracked off. It'll break off.
Uh-huh.
It'll have a stress fracture from repetitive pull and torque. So what we do is come in and come under it. Again, I'm going to make it kind of a gross sketch here. And that's the calcaneus, if you will, as the bone, and here's the tail's above it, and the rest of the foot going down towards the foot. The plantar fascia is under here, coming down. So if you shave this off, this is grossly depicted, then the plantar fascia is not detached. We don't cut it. We just take the spur off, eliminate that. So the next image is plantar fascia is now just resting against now a cancellous smoother surface. The spur itself is gone. That spur is gone. And now it'll just heal back. The backside's never detached. It's just the front third that's detached and then smoothed off.
It seems to me, though, this is a very underutilized treatment for a very challenging problem, and I don't understand why that is. Can you give me a little historical perspective on that?
Historically, of course, plantar fascia, nobody ever dies from it, and nobody really has severe trouble all the time. It comes on very significant stages. Some people become immobilized by it, particularly nurses, construction people, things, guys of that nature. So what happens is that it becomes so painful, they change their lifestyle. They quit running, they quit working, they can't exercise.
But you have like a zillion shoulder scopes today and knee scopes and all that stuff. Why don't we have more, why aren't you doing more plantar fascia surgery?
Well,
and other doctors too. I'm still not getting that point.
there's never a procedure actually developed for it.
Okay.
Okay? Now the podiatrists usually take care of this, and they've got several procedures. They have a procedure where they'll cut the plantar fascia in two horizontally. There's a thing called a star procedure where you put needles into the heel and kind of pie crust the wide plantar fascia, and it stretches it out.
Okay.
Okay? Kind of like expanded metal.
Okay.
Expand it out.
All right.
Okay? So having watched that for a long period of time, about 10 years ago now, here's a plantar fascial spur. It's a classic example. And this is a pretty nice large plantar fascial spur for what it's worth. Okay? So what we'll do is we're going to take that segment off. Okay?
Did you create this procedure, Kenny?
I did.
Okay. That's why you're not telling me this. Okay. Because you're being modest.
I did, correct. And then we've done about 500 plus of them.
Okay.
And our satisfaction rate runs around 93, 94%.
Okay.
Okay.
So it's one of your more satisfactory procedures to do as well.
And their only side effect is you'll have a little soreness on the heel. Some people can get over it within 3 days. Some people it takes 3 to 6 weeks. It's just a variation of different people.
Okay.
But it takes about, it's about a 10 or 15-minute process to where we do it. We can do it with standard arthroscopic equipment. Patients asleep for about 15 minutes. And they can walk on it with a bulk dressing for about 2 or 3 days, and they can still go to a shoe like a croc or a loose sandal within about.
All right. So hopefully in a few minutes we'll get in there and try to see one.
They
Okay.
can see one, yeah. It'd be very helpful.
Okay.
Have them see it. They can see it in live.
All right.
Okay.
Thank you. I'm going to finish here. Is that okay, Kenny?
Yeah.
Very good. Thank you.